Hi, my name's Jack Mills. I'm one of the occupational therapists in a hospital in Manchester. I'm about 2.5 years qualified now, since leaving university, and I've been working ever since, really. I've been asked to do this video to try and help people understand the role of OT and more about it, really. Yeah, so first of all, why I chose OT as a career, because basically I wanted to work in the healthcare profession, and I wanted to look at things like nursing, social working, physiotherapy, occupational therapy, and I looked at being a nurse, and that's something that I didn't want to do. So I looked at other professions similar to nursing, and occupational therapy came up, and I liked the idea of it. So I did more research into it, and then I shadowed a few occupational therapists in Manchester, and I found that I really enjoyed it. The people I shadowed was a mental health hospital, and the OT role there was very different to it is in different settings, such as an acute hospital I work in now, or in the community, or in paediatrics with working with children. So I chose it because it's obviously very rewarding career I found. I do make a difference to people's lives. You get involved in everything to do with the life and the rehab. So you look at everything from brushing your teeth to driving the car again, to getting on and off the toilet, to managing to wash and dress themselves. You know, I found that physios look at rehabbing, getting the patient walking again, but we do everything from, you know, being able to engage in anything in the life that they want to do again, like we all would. You know, it's okay, I can walk now, but what about getting dressed or walking to school or driving my car or, you know, making meals for my family or going out with my friends? How do I do that? And that's what an occupational therapist can help with. Why did I choose OT at York St John? Because firstly, I'm from Manchester, so I wanted to go to uni in not a too big city because I'm already used to that anyway. And I did a lot of research. I found that York St John are quite established in their OT you know, course, and there's a lot of really good lecturers at OT at York St John who are very well established and have published many journals and everything like that. So the course itself was very established, and I thought that was really interesting. I want to go to a good university. If I'm going to go to university, I want to go to a really good one. So I found York St John to be that, and its reputation, and also the city is just lovely and beautiful. It's really historic. It's nice for your family when they come up to see you, going around all the shops and all the bars and restaurants and bringing your friends up, and then going into a smaller city really, where you get to know it off by heart. You don't know any part of York, whereas if you go to a big city, I found that, you know, you feel a little bit lost. So that's one of the reasons I chose OT at York St John. What areas have I been working since I qualified? So first of all, there's so many different areas you can work as an occupational therapist. So many. I'm currently in the acute setting, so that means working in a hospital or on kind of like the front line. So the first patient contact you see is in hospital. So when you get admitted to hospital, if you need obviously therapy, either physio or occupational therapy, I'm, you know, the person that you see. So I started off on orthopedics, which means bony injuries, like when you break your hip or break your arm, break your leg, you know, you break your ankle, you end up on an orthopedic ward. So obviously, as you know, the physios and, you know, us guys as OTs work alongside each other to get the patient home and get them rehabbed again, practicing things like washing and dressing, kitchen assessments, identifying any equipment for discharge or putting that in place to make the person more independent when they get home. Obviously you're working alongside the doctors and the surgeons and the nursing staff. I've worked on the medical ward, so that's covering all the generic medical wards in the hospital where people get admitted to, and you're screening for patients who are, you know, at risk of going home and the high risk of falls or they need any more input. I've worked in stroke, I've worked in paediatrics, I've worked in surgical wards, I've worked quite a few places. A typical day for me at the minute, obviously COVID had made things, you know, quite different, but a typical days for me is coming into the office, saying hello to my colleagues, having a coffee, and catching up with patients and talking about different things. And then we have certain wards that we cover, so I go onto the wards and kind of triage the ward list for the patients who have been admitted, see if they need therapy or not, or look at any referrals that we've got. And then we just work through the list and see the patients for that day, whether that's rehab or discharges, or you know, any specific OT needs or physiotherapy needs we look at. And then we might come back down to the office and do some non-clinical things, looking at evidence-based practice, outcome measures, which I'm doing a big project on at the minute. So, and the most rewarding part of my job is hearing patients say, you know, you make a difference to my life. And if I didn't see you in hospital, I don't know what I would have done. Or thank you for your, you know, your input that you've given while I've been a patient here. You've made my life, you know, so different, and I couldn't walk and now I can. All things like that make a big difference. So yeah, go for occupational therapy.